as we lose weight, we also lose volume in our mid-face, especially in our neck and other areas of our body where we've lost subcutaneous fat and tissue. And for some reason, I see it more like in my older patients because of that menopausal effect. As a younger patient, you can lose that volume, but you're not losing as much collagen. So where Sofwave comes in is because it targets the mid-dermis where collagen and elastin is made. So it's great for improving that Ozempic face and helping to lift the jawline and neck area, the crepiness and sagging of the neck that one might get after weight loss. It helps improve the laxity and crepiness of the upper arms. You don't need anything surgical. Use a non-invasive energy-based device that has no downtime, minimal discomfort, takes 30-45 minutes, and you're done.